My brother took his own life before he received the care he needed. Is it right that people like him have to wait up to 18 weeks for help, whilst there's calls to limit it to a maximum of 7 weeks?
It's not. It's outrageous. And it's one of the great injustices which I think we're about to, cross fingers, we're about to finally remedy and correct. Under the waiting time standards that I'm introducing, they'll start later this year, you'll be seen in 2 weeks, just as if you're being referred for a first diagnosis of suspected cancer. There's a massive benefit in early diagnosis, and there's equally a massive benefit in making sure that they are treated as much as possible where they can still be at home and not put in an institutionalised setting. The tragedy of a young person who's very, very vulnerable and desperately needs to be seen quickly is a tragedy which has afflicted far too many families.
I actually a few years ago chaired at Green Party Conference a session on mental health, which is where I learnt the phrase parity of esteem. And what that means to me is if you've got a broken leg and you go into A&E, you might have to wait for a few hours, the way things are these days, but you're not going to leave hospital without that broken leg being treated appropriately. But you go in with a sort of mental health issue of similar seriousness, you're very likely to be sent away and told there's a 6-month waiting list if you're lucky. And one of the things that I'm really proud about is the Green Party manifesto. There'll be a very strong focus on mental health services in that. And what we've seen is an absolute slashing away of services, both hospital services and in the community. And that's, in terms of humanity, absolutely unacceptable. But it's also makes no sense in that we're leaving people to get iller and iller and iller, and then of course it costs a lot more to treat them. What we've got to do is that phrase parity of esteem, and the division between physical and mental health is something of an artificial one anyway, but if you say physical health, that's what we need to do about it. That gets treated in that period of time, there's that level of services and support. We need an equivalent level of services and support.
Mental health is something I have been passionate about talking about and trying to tackle the stigma since I came into Parliament. I know from personal experience how very difficult it is for families when poor mental health affects a family member. And no, I mean, we want to see faster treatment basically. We have as a government legislated under the Health and Social Care Act for parity of esteem between mental and physical health, which means they should be treated equally within the NHS and get the same amount of attention and resources. And we have announced recently waiting time targets for the first time for mental health. We are making progress, but I think I will be the first to say on this whole area there's a lot more that we working within the NHS need to be doing.
Mental health is one of the things I'm really passionate about, actually. And one of the first things we'll do is, for the first time, we'll be the first party to actually put mental health on an equal footing with physical health. We have separated the two, I think, at our peril. The two are very much interlinked. If you have a severely debilitating physical illness, which I have actually, that affects your mental health. And if you have a mental illness, that means that perhaps you don't look after yourself as well physically. So the first thing we're going to do is make sure we put them on an equal footing. Overall, we're going to be spending £3 billion extra a year. UKIP's pledged to put an extra £3 billion a year into the NHS. As a result of money we'd save from leaving the European Union. And we'll certainly be investing funds into mental health. The actual budget for mental health has plummeted since 2010. And I think that's a great scandal.
We did a report on this, the O'Brien report, which looked at what needs to be done. We want to work towards this 28-day waiting time for talking therapies. We're looking at how we can do it at the moment. And there's two things that I think could make a difference. One, giving more of a priority to mental health within the overall NHS budget. And then secondly, and I'm afraid this tragically speaks to your brother's situation, child and adolescent mental health is, if you like, the poor cousin to mental health, and mental health is a poor cousin to physical health. So we've also said we'll raise the proportion of the budget spent on child and adolescent mental health, because I think CAMS, as they call it, is, massively underfunded and a real problem. And so let's have that taking, if you like, more of a slice of the mental health budget, and the mental health budget having more of a priority in the overall budget.
There's been an increased focus on mental health recently in the media and more widely in society. So what do you intend to do to make sure that people get treated equally and mental health gets realistic funding?
I think at the moment lots of people just have no idea what to do, and that's not acceptable. So we need that training and that support so that people know what to do, where to go, what to say. which I think a lot of people don't at the moment. So what we really need is that kind of support, a whole strategy to deal with this issue. But I think there's also a much broader issue here, which is, we're seeing levels of mental ill health, including self-harming, really escalating among our young people. And there's a whole range of issues behind that, in terms of stress, in terms of poverty, overcrowded housing, the bedroom tax, fear about the future, fear of failing your exams because you feel like if you don't pass the exams, it's the end of the world. That we're living in a hugely stressful society that really is helping to create these mental health problems.
Not least because of campaigns like Time to Change, because of people like Alistair Campbell, Stephen Fry. I hope I played my bit, because ever since then I've always spoken about mental health. It really has changed the climate. People are talking about it much more. We're lifting the lid on mental health. It's almost like a constitution for the NHS. It's called the NHS mandate. It's the mandate which everybody in the NHS has to work by. I got the wording of the mandate changed, so there's now a legal requirement in that mandate for people working in the NHS to treat mental health on the same footing and with the same esteem, and attach the same significance to physical health. I think all of those things, I haven't got a magic wand. I don't want to pretend everything's going to be changed overnight, because we're changing decades of things that were wrong. But I touch wood. I think if we were to have this conversation in a few years' time, I think things will have changed quite dramatically.
We also want to stop the postcode lottery of mental health treatment, particularly with, for instance, if you go into hospital and you quite clearly need mental health support as well as physical support when you're at A&E or having an operation or whatever it might be. So improve funding for liaison psychiatric services as well. We're going to put 130 million into dementia specifically, which is something that particularly affects women. It's the biggest killer of women, actually. And we also want to look at addiction, because I think mental health and addiction, again, are two things, and you mentioned self-harming. And I think self-harm is a form of addiction, and you need to not separate those two out as well.
I think the most important thing I've learned on this is that mental health isn't just a health services problem, it's everybody's problem. And so you've got to have schools that know about it and can deal with it. You've got to have businesses. Some businesses are good at recognising the issue, but lots of businesses aren't. And I suppose the other thing is end the stigma. It's tragic when people get cancer or heart disease or whatever, but they aren't embarrassed to talk about it, more by and large. Whereas actually mental health is something lots of people are embarrassed to talk about. And that is a massive problem for solving it. So it's also about, let's raise the awareness of the issues and be willing to talk about it as an issue which needs to be dealt with.
Well, the Health Secretary has he published something called the NHS Mandate, and that's a mandate to NHS England each year, which sets out the priorities for NHS England. And the last NHS Mandate really had a lot of mention of mental health, not just the parity scheme, but also then what that meant. And so actually I think having transparency, having more published data about waiting times and treatments, everything else, goes a long way to helping people to know what they should be expecting, and therefore if they don't get that, what they can complain about. With physical health you can present at A&E, or you can, something will happen. I think with mental health it's very difficult to know where to go, and often there's a crisis very, very quickly. And so we published this Crisis Care Concordat as well last month, so that people can know what to expect.
Care support and services vary greatly across the country, with some parts of the NHS spending as little as 6.6% of their budget on mental health. Will you put in place a national strategy to stop this postcode lottery?
In the Green Party, we have a very strong philosophical belief in localism and that local decisions should be made locally. But the role of the national government should be to set a foundational standard, to say that this is a level below which no one should go. No one in the country should have services that fall below this level. And that means obviously adequate funding, but it also means in terms of the NHS, there's huge issues around the cost of privatisation, PFI, private finance initiative schemes, and the whole market mechanism in the NHS. So we can find money by taking out those costs, those privatisation costs. We can actually find the money to put in. But in terms of where it goes, we need that foundational level, which means that foundational funding.
Well, I've mentioned some big changes to you already, particularly the introduction of waiting time and access standards. The biggest change of all, bear with me for a moment, is actually the most technical of all, and it is this. For years, hospitals and NHS trusts would get, and still are, get paid basically for what they do per patient. I think they call it in the jargon output funding or something like that. Mental health trusts, by contrast, were always given block grants, just like a lump of money. But it was unrelated to how many people they helped or whether they actually helped individuals at all. And the consequence of that was that every time savings had to be made, and of course we all know savings have had to be made, the easiest thing for NHS managers to do is to basically keep shaving and salami slicing the budget of the block grant given to mental health trusts. I've insisted, and we're again doing this year, that we put mental health trusts, the funding formula for mental health trusts, on exactly the same footing as what they call acute trusts. So you're actually paid because of the number of people you help and how well you help them. I think that will have a dramatic difference.
I think it's about actually beefing up services right across, well, England, because obviously the services in Wales and Scotland had evolved. So talking about mental health in England, I think we do need to have a mental health strategy for England, absolutely, yeah. And that will include things like funding, it will include things like swift referrals, it will include things like getting people help for addiction treatment and trying to preempt. And also I would like to see a situation where everyone who's diagnosed with a life-changing or terminal illness is automatically offered referrals to a mental health service as well. They can turn it down if they want to, if they really don't think they need it, or perhaps go back at a later date. But I think we underestimate the mental health side of our whole being, our peril. So that's what I'd like to see happen.
We set out a very clear sort of proposition and promise that we're going to raise the proportion of the overall mental health budget spent on CAMHS, because frankly, it's, as you said, from the situation in Cornwall, there just aren't the services so often. And people say, well, doesn't this cost money? Yes, it does cost money, but it's really important to say that it saves money, actually. I had this, I think I mentioned it earlier, I've had this contact with people who've been having mental health issues, and they always say, if only I'd had the help earlier, it would have actually saved not just heartache later, but also would have saved resources later.
Well, we have published as a government something called Achieving Better Mental Health Care by 2020. And so again, I think it's about that relentless, it's about asking those questions, which is why is one part of the country spending less on mental health care than another part of the country? What can one part of the country learn from what another county or area is doing? And it gets people to know that there's their mandate, they've got to meet the mandate, they've got to report against the mandate, they've got to explain where the funding is going. We can again say, well, actually, why is it that certain parts of the country are not spending as much on mental health, or their outcomes are poorer? There are more people with poor mental health in one part of the country than there are in another.